So we are back. Andyan na rin si Jennifer at saka si Romelda.
Jennifer is in. And Romelda is in.
Patay kasi ilaw kanina. Ha? Kami nagkikita sa dito. Isang wato na lang. Oo.
So, sino pang hinihintay natin? Si Teresa, si Tisay. Wala namang message si Teresa na malilate siya, di ba? Wala siyang message na malilate.
Ay, ito na lang muna. Kasi grabe, tambayan. 24 hours, hello. Yung pawis nito sa may leg, ang ikatin ko. Ano mo lang internet?
Meron.
Ano, si mga na ano? Hindi maliliit. Ano pa maliliit? Hindi ko kumain kanina. Hindi, kumain ako, pero paroto lang. Bumili kami ng samsang. Hindi ko gano'n. Di ba kasi kayo na mga biscuit? Ano, sa mga 11, mga 1 na ako nag-biscuit. Tapos nagkape. Kaya gusto pa ako hindi ko natin sila.
Anong gusto niyo? Mag-umpisa na tayo. So, hayaan natin silang dumating at mag-catch up sila kung saan nila aabutan.
Kaya po, ma'am. Basta iniinta na lang po natin si Teresa.
Si Teresa na lang, di ba?
Yep,
Siya na
siya
lang
na lang
naman.
po.
Okay, sige, mag-umpisa na tayo better. I think mas mainam kung darating na lang siya kasi wala siyang pasabi, di ba? So I think better na tayo ay mag-umpisa. So sige, last time, ang diniscuss natin last time about housekeeping, di ba? So, and then, naggawa din tayo ng oral recitation natin. May restate tayo last time. So ngayon, we are going to talk about vital signs. Ito yung importante na gagawin natin as magiging practical natin na talagang gagawin o part of doon sa ating trabaho na magiging trabaho natin as in actual. Okay, ito yung vital signs, ito yung the first and foremost na gagawin natin pagdating natin sa isang healthcare facility. Okay, so kailangan pag-aralan natin ito, yung theory nito. Andyan na ba si Yilma? I'm talking in Tagalog.
Yes, Yilma is in.
Yilma is in. Okay, so okay. So Romelda, Yilma, how are you? You are already at home, Yilma.
Yes, ma'am. Good evening.
Okay, so good. So now, as we are going to talk about the vital signs. Vital signs is very critical in our work. As for the nursing aid, this is one of the most vital or the most important, work if you are already going to be in a healthcare facility. Okay, because the first and foremost, they will ask you, take that vital signs or take the vital signs of that patient. That is the first and foremost they will ask of you to do. So as for now, we are going to talk about the vital signs. So please, whatever we are going to discuss in here, listen carefully. And once we apply it in our practical assessment, we are going to do all of this in a physical assessment or in a practical, in actual. So it will be in our, I think it will be next after this level or on the 4th level. Okay? So we will be doing our competency on how are you going to do it, to carry it when you are going to start your work. Okay, so vital signs is the most important thing in our work as a nursing aide. So going forward, we want to learn in these vital signs, what should be the definition, the purpose, what are the vital signs, what are the vital signs illustrations that I will show you, medical terminologies relating to these vital signs, description of the vital signs, and the vital signs procedure, which we are going to have it in actual. we will have the return demonstration on how to measure the vital signs and how to do it. Definitions of the vital signs. They are the clinical measurements. They are clinical measurements of the body's most basic function. Oh, there is an echo. Something there is static there. Okay, so anyway, to
Yes,
continue,
ma'am.
vital signs are the measurements of the body's most basic functions. Okay, they are the clinical measurements. Specifically, there are pulse rate, temperature, respiration rate, and blood pressure that indicates the state of a patient's essential body function. So why we need to do it? Why the doctors are requiring us to do it? For a purpose to establish a baseline on admission to a hospital, clinic, or other encounter with a healthcare provider. So vital signs may be recorded by a nurse, by a nursing aide, by a physician, physician's assistant, or other healthcare professional who are definitely or absolutely competent enough to do it. Okay, so we are the one going to do it in a healthcare facility. So what are we considered by, what we consider as the vital signs? We have 7. Number 1 is body temperature, pulse rate, respiration rate or the rate of breathing, blood pressure. Blood pressure is not actually considered as a vital signs. But whenever you come to a doctor or whenever you come to a healthcare facility, it is measured. It is included in the vital sign taking of the TPR. We are talking about the 3 TPR, the temperature, the pulse, and the respiration. So in the new time or in this present time, so they added to take blood pressure. And aside from blood pressure, they added another 3 to include oxygen saturation or the O2 and the weight and the height. So there are 7, a total of 7 for the vital signs to be taken. So these are the body temperature or the photograph or illustrations of a body temperature. And where are we going to, where are the sites where we can take the body temperature or where we can measure the body temperature? Number 1, on the upper side, we can measure it through oral. So orally, by the mouth, so we can take the first oral thermometer. Oral thermometer by the mouth is oral temperature. Secondly, we have the axillary. It is taken in between the armpit, between the folds of the armpit. So it is axillary. We have number 3 is tympanic. So it is taken by the ear. So it is being used for the children. Number 4, we have rectally. We are taking it for the infants and around 3 months old babies. So we are taking it rectally by rectum. And the last one is the most popular nowadays because of this COVID-19 pandemic. So everybody is taking the temperature by skin. It is taken by the forehead, the skin on the forehead or the temporal region. Okay, so we have 5 ways to take the body temperature. So we have the stethoscope for the heartbeat. So we need the equipment like a stethoscope to the left We are calling it a stethoscope. This is the instrument or the device that we are using to auscultate. You can see the photo on the right. So the doctor is using, or the nurse or any healthcare provider, they are using the stethoscope, which is used to listen to the heartbeat. Okay? So when we are going to take the respiration, we are not going to use a stethoscope. But if we are going to take the heart rate, we have to use the stethoscope for that. In taking blood pressure, we have the equipments like the aneroid BP, aneroid blood pressure monitoring, the wrist digital, the upper hand, the vital signs monitoring mobile, which you can find. The last one, you can commonly see in a medical center or in a hospital. So this is the most common now because it is complete. I mean, the blood pressure is there, taking the temperature is there, taking the oxygen saturation is there. So all in one. So you can just pull it whenever a patient is there. Height and weight. These are the height and weight scale. Weight is scale and the height is scale. So we are using to take the height and the weight of the patient. So on the left side, we have the height and weight, where in the height, there is called stadiometer. The other side, for the right side of this weighing scale, so this is called stadiometer for measuring the height. In the middle, we have the weighing scale, baby weighing scale, infant weighing scale. So this is used for the babies and the infant around 1 to 3 months. And to the right, the end of right, we have the normal. This is the bathroom scale. Okay, so I have shown you already the instruments and the equipments that we need to use for taking the vital signs. We have also the pulse oximeter. This is one additional to the vital signs, and we are taking it to measure the oxygenation of the human body. Okay, so this is included in the vital signs. So there are some medical terminologies that goes with the vital signs. Number one, we have fever. So everybody heard about fever. Everybody knows what fever is. Is there anybody who knows what fever is? Okay, so anyway, fever is a temperature set point. Is in the level at which the body attempts to maintain its temperature. But when the set point is raised, the result is a fever. So means to say, once in the temperature, if you will measure the temperature and it is above the normal, so it will give you, the doctor will just tell you that you have a high fever or a fever. So most fever are caused by infectious disease and can be lowered if desired. But if you will only take an antipyretic medication, which is most common, the Panadol, right? Anybody is taking Panadol when you feel like you are hot, you have fever, you're not feeling good. Okay, so actually it is not good to take medication like Panadol when you have fever, because we don't know what temperature, what infection causes to rise your temperature. Okay, so why you have fever? So it's difficult to say why you have fever. Okay, the second medical term is hyperthermia. Hyperthermia, hyper means high. Okay, so high and thermia is temperature, means to say high fever or high temperature. So it occurs when the body produces or absorbs more heat than it can dissipate. It is usually caused by prolonged exposure to high temperatures. The heat regulating mechanism of the body eventually becomes overwhelmed and unable to deal effectively with the heat, causing the body temperature to climb uncontrollably. High temperature or the temperature above the normal. So it is above 40 degrees centigrade. We are calling it hyperthermia, or 104 degrees Fahrenheit. It is a life-threatening medical emergency that requires immediate treatment. So commonly, the symptoms includes headache, confusion, and fatigue. So it is very high temperature. If we are saying that the temperature, like if we are going to take it orally, it will be like 37.2 degrees centigrade. Here in the hyperthermia, you will be able to take or to measure 40 degrees above. Okay, so the patient is going to be confused. The patient is going to be lethargic or fatigued. The patient has severe headache. Okay, and resulted in dehydration. Then the affected person may have dry and red skin. Okay, going forward, we have hypothermia. Hypothermia means hypo, okay, is low or below the normal, or thermia is fever or the temperature. So in hypothermia, the body temperature drops below that required for normal metabolism and body functions. In humans, this is usually due to excessive exposure to cold air or water, but it can be deliberately induced as a medical treatment. So we know now if it is above the normal, which is more than above the normal, it is hyperthermia. It is above the normal temperature. But if it is hypothermia, we are talking about the body's temperature drops 1 to 2 degrees centigrade, 1.8 to 3.6 degrees Fahrenheit below normal temperature. So when we talk about the body temperature, this is the #1 vital sign. So when we talk about the normal body temperature of a person, it varies depending on a gender, recent activity, food and fluid consumption, the time of the day, and in women, especially the women, the stages of the menstrual cycle, or during the time we have a period, or when the women is above 40, they are already experiencing the menopausal. Okay, so the body temperature, when you take it, it depends on a person, it depends on his gender, the age of the person, the recent activity, what they are doing, the food, the fluid consumption, the time of the day, if it is outside, if it is very sunny outside, so your body temperature is going to be high. So if you're going to be in Baguio or in Benguet or in the higher places, it will be cold. So it depends on the temperature of the environment also. So, and in women, if you are undergoing or starting in the process of your menopausal, or of in the women who are in the who are having the period, so the body temperature also changes. The normal temperature can range from 97.8 degrees Fahrenheit or equivalent to 36.5 degrees centigrade or Celsius to 99 degrees Fahrenheit to 37.2 degrees centigrade for a healthy adult. So we know now that's the body temperature for the normal body temperature, it's 37.2 degrees centigrade for a healthy adult. So a person's body temperature can be taken at any of the following ways. Okay, so our body temperature can be or may be abnormal due to fever or the high temperature or the hyperthermia or the low temperature, which is the hypothermia. A fever also is indicated when a body temperature rises about 1 degree or more over the normal temperature of 98 degrees Fahrenheit, according to the American Academy of Family Physicians. Okay, so hypothermia is defined as a drop in body temperature which is below 95 degrees Fahrenheit. So now with the body temperature, it's a little bit confusing. Okay? What is that sound? Okay, so the body temperature is a little bit confusing because we are talking about the normal range. There is a figure. Okay, so when we are talking about the figure, we must know for its body temperature or for its measurement, okay, for the vital signs, we need to know the normal measurement because we know how to compare. If you will not know the normal temperature or the
Ma'am, wait.
normal respiration rate,
Excuse me, ma'am. Masakit sa tenga.
yun na nga eh.
I-mute na lang po yung ano natin, yung mic na lang po para hindi po maano.
Oh yeah, it is okay. I think somebody is using
Electric fan.
electric fan or something that induces the sound. Okay, so anyway, it is, yeah. So it is okay now? So it is clear. Okay, shall I continue? Okay, so as I'm talking, in taking vital signs measurement, the first thing we need to know is we must memorize. This is we need to memorize. We need to memorize the normal measurement, the normal body temperature, the normal measurement of the heart rate, the normal pulse rate, the normal respiration rate. Okay, because we cannot know or we cannot compare if the body temperature which you have taken now is normal, hyperthermia, or hypothermia. Okay, so the normal body temperature is 37.2 degrees centigrade. So body temperature may be abnormal, as I said, it might be high, hyperthermia, or it might be low, hypothermia. So a fever is indicated when body temperature rises about 1 degree, as we said so. And according to the Academy of Family Physicians, so the hypothermia is defined as a drop in body temperature below 95% degrees Fahrenheit. So as you can see here, to the left is the digital thermometer. Nowadays, almost every measuring devices, they are almost digital nowadays. So previously, we have the one with the mercury. So it is not good for the body. It is not healthy because it's going to have a mercury poisoning. So they banned it and they remove it from the market. And in this one, and they replace with the digital measuring devices, like the digital thermometer for taking the body temperature and the thermoscanner, or we are calling it the thermometer infrared, or the thermometer sensors that we are using right now, as it is commonly used for the COVID-2019. So there are ways of taking body temperature, and we have 5 ways, okay? We have 5 ways of taking body temperature. Number 1, we have oral temperature, which is taken orally by mouth, okay? So number 1 is oral temperature taken orally by mouth. So this temperature can be taken by mouth using the modern digital thermometers that use an electronic probe to measure body temperature. Secondly, we have the rectal temperature, which is taken rectally by rectum. So temperatures taken rectally using a glass or digital thermometer, that was the olden days, tend to be 0.5 to 0.7 degrees Fahrenheit higher than when taken by mouth. So imagine now, in oral temperature, it will be like 37.2. While in the rectal temperature, it will be 0.5 to 0.7 degrees Fahrenheit higher than taken by the mouth or by oral temperature. So in axillary, it is the temperature taken under the arm, sa kilikili. Okay? Sa ilalim ng fold sa kilikili. So these temperatures can be taken under the arm using a glass or digital thermometer. So temperatures taken by this route tend to be 0.3 to 0.4 degrees Fahrenheit lower than those temperature taken by mouth. So now we can see now, oral temperature, as for everybody, it is the best to take for oral temperature. And the rectal temperature is higher of 0.5 to 0.7 degrees than the oral. While the axillary under the arm is lower. These tend to be 0.3 to 0.4 degrees lower than the temperature taken by mouth. So you can see now there are differences. So what I say is, if you have to memorize the normal temperature, so you will know exactly how to measure whether it is normal, it is below the normal, or above the normal, or if the patient is having temperature or hyperthermia or hypothermia. So going to the number 4, we have the tympanic temperature, which is taken by the ear. So it is a special thermometer that can quickly measure the temperature of the eardrum. So which reflects, when you are taking the tympanic temperature, it will reflect the temperature of the internal organs. But this is not mostly be used. It is not commonly used. So it is only by special, like if those patients are irritable during the time that they are going to take for the oral temperature or the rectal, so they are requiring to take the tympanic temperature by the ear. So by skin on the forehead over the temporal, this is the one that we are using normally now, or most commonly now when everyone is taking for the COVID screening, that the forehead is being scanned. So they are using the temperature, the thermometer for the thermal scanner. It is by the skin over the forehead or over the temporal artery. So as we know, we have 5 ways of taking or measuring the body temperature, okay? So it is the oral thermometer, orally taken, oral temperature. So we have the axillary temperature taken by axilla. And we have the rectal temperature taken by rectally. We have the tympanic taken by the ear. and we have in the skin, on the forehead, taken by the thermoscanner. So we have 5 ways of taking body temperature. So now, what are the indications for this measurement? Why do we need to take this temperature? Number 1 is to obtain a baseline temperature to enable comparisons to be made with future recordings. Like for example, it's the first time you come to a hospital or to a medical healthcare facility. So definitely from the triads area, a nurse or a nursing aide will take your body temperature for baseline. So it will be your baseline. The next time after a week, you will be back to the clinic and definitely again, they will be taking your temperature, and that is the comparison. They will have the comparison between the readings from the first and the readings for the present. Number 2 is to enable close observation in resolving hypothermia or hyperthermia. If like for example, the patient is in the hospital and it is for close observation. What means to say, the patient is going to be taken a temperature or a reading of by the thermometer every 15 minutes. So in this case, the nursing aide is going to check the temperature, and the doctor, if you are going to inform the doctor about it, so he has to know whether why it is hypothermia being hyperthermia and what is he going to do with it, okay? So this is going for the close observation. To observe and monitor patients for changes indicating an infection. If you have fever, you have the infection somewhere in the human body or in the body. So the doctor is asking you to take the measurement of the body temperature, because what he wants to know is if there is any changes indicating an infection with the patient because of the high fever. So he wants to know whether it is going to be from the baseline that you have taken at first, or there is a change. It went high or it went low. So to monitor the effect of treatment for antimicrobial therapy for injection, for infection. Like for example, the patient is already in the hospital, and now the doctor is monitoring the effect of the treatment. Like he already started an antibiotic. Okay? So from then on, because of this fever, he gave or he ordered the treatment for antimicrobial therapy for infection. So he wants to monitor whether in every 15 minutes or whether in 30 minutes, the temperature of the patient rises, there is a change. That means to say, if it's going down, the temperature is going down, means to say there is an effect of the antibacterial or antimicrobial antibiotic therapy for infection that he is giving. Okay, so that compares, the temperature, whether when he started the medication, where that fever, there is a hyperthermia during that first time. And now, after the 5 days of taking the antibiotics, so the temperature goes